Hi, my name is Jolie. I am a certified medical assistant and I work in a podiatrist office. Podiatry is the study of their feet and their alignments. I do want to give you a heads up, a lot of the photos on here are slightly gruesome, so if you do not want to watch, you do not have to. My interest has definitely grown in podiatry within the past year and a half, ever since I started working in a clinic myself. It is very different. We see a lot of different things all the time that I didn't even know should be a precaution for older people or diabetics in general. Podiatry is very important to everyone because you could become an amputee in the blink of an eye. Most diabetics do not have full feeling in their toes leading all the way up to the tops of their feet. Some people who are not diabetics also have neuropathy. Neuropathy is a constant burning sensation that makes patients feel as if they have pins and needles in their feet. Podiatry is a very important field that most people do not recognize until they truly need to. Why is this important to people before 1877? Before 1877, most hospitals were very unsanitary and uninformed about how fast infections could lead to the unthinkable. This right here is what we call a foof. It is referring to a tooth in the foot. Excuse me, this is not a real thing, so don't worry, you guys aren't going to have a tooth growing in your foot. It was just an extra bone growth that we had found in a patient, and we removed it during surgery, and it just so happened to be in the shape of a tooth. So we know that professional foot care has existed since at least 2400 BC because of the bass-related carvings in ancient Egypt at Angomor's tomb. Hippocrates, which is a Greek physician, gives more evidence of professional foot care when he talks about removing corns and calluses on the feet. The original scalpels were invented by Hippocrates to help scrape skin and remove these hard skin spots. These scalpels before 1877 were most likely not switched out after each use, shown by the large amount of infection during the Civil War and other time periods. It is stated that the scalpels before the 1900s were shown to be very large and similar to a kitchen knife. As you can see right here, this is the size of the average scalpel that you would use, which is actually very difficult if you are looking to debride at a small area on the bottom of the foot, such as this one. This is before debridement and after debridement. It would be very hard to get that small little area out of the foot if you are using something as large as a kitchen knife. Similarly to today's world, podiatrists also use scalpels to debride at the calluses typically located on the bottom of patients' feet. Sometimes patients also have calluses on the tops of their toes or in between them due to friction from other toes and shoes. Sometimes calluses choose to grow not because of friction, but because of the shape of your foot, placing so much pressure on a specific spot of your foot. Your body then thinks you need to have more protective layers, and on that pressure part of your foot, you will then grow a callus due to the thick layering of the skin. As seen by the statistics of how common amputations were, it can show the amount of cleanliness doctors and patients were lacking. When scalpels are used today, the blade is inserted into a blade flask to dispose of, and the handle of the blade is placed into an autoclave to be sterilized and used again later. Calluses can easily turn into a non-healing diabetic ulcer or a non-healing ulceration if you are not a diabetic. This is an open wound that has a very hard time healing even if you take care of it correctly. These calluses that lead to diabetic or ulcerations can also lead to amputation. So up until the 20th century, doctors who focused on feet, ankles, and legs were called chiropodists and considered separate from other types of organized medicine, which is odd because they are underneath a specialist doctor category because they are specializing in feet, ankles, and toes. So I do find that very odd. But the first professional chiropody society was established in 1895 in New York, with a school opening not long after in 1911. The term chiropodist switched over to podiatrists all the way until the 1960s, but in the United Kingdom, both terms are used today. Now, the history of podiatry is quite interesting. There are more recent historical references to podiatrists and those who use them since ancient Egypt and Greece, including the King of France and Napoleon, who both had a personal podiatrist. Abraham Lincoln also had a personal foot doctor to help care for his ingrown toenails and troublesome corns. Abraham Lincoln's personal podiatrist was named Azar Zachary. Mr. Zachary has been working in the medical field since he was 10 years old. Starting out as a physician's apprentice at 10 years old is pretty impressive if you ask me. Later on in life, Mr. Zachary migrated to the U.S. with his family and started to begin the path of podiatry. He most likely had no idea he was going to be a personal doctor for the President of the United States. Turns out, Mr. Zachary had some phony activities to get him where he got. It is shown that he not only published made-up endorsements from newspapers that other physicians wrote about themselves to get his name out, he also claimed to have a medical degree from a school in Cuba using authorization from a podiatric manual that he also plagiarized. He may not have become a real podiatrist, but I sure hope that he learned enough to not ruin his patients' body parts. I do feel bad for Abraham Lincoln not knowing, because he most likely did not know. It is said that Lincoln would spend hours on end with his personal podiatrist, and he would frequently recommend Mr. Zachary to the Union Army's Commission of Chiropodist General of the United States. Zachary did some more questionable things regarding the government in the early 1970s. He served in the non-existent position of Chiropodist-in-Chief to the Union Army during the Civil War and attempted to bill the U.S. government an amount equal in 2020 to $1 million in services rendered. Now, in regard to President Lincoln's ingrown toenails, I find it odd that Mr. Zachary would constantly take care of the ingrown nails. But now looking at that, he was not a real podiatrist, so it all makes sense. I'm not sure if there was a permanent solution for the treatments of the ingrown toenails, but today we use phenol. Treating an ingrown nail is typically one of my favorite things to do in the clinic. The steps of treating an ingrown nail is very simple. We start with numbing the whole toe with lidocaine. After numbing the toe with lidocaine, we then cut the side of the nail that the ingrown is on. When we remove that whole side of the sliver of the nail, now it is just the corner of the nail. We often do remove the whole nail, but only for other issues, never for ingrown toenails. It is common to place a small amount of phenol in the corner of the nail bed that you have now removed. This is an acid that kills the nail bed and gives you less than a 5% chance of the nail growing back in that selected area. This phenol will burn, making the nail practically unable to grow on that nail bed of the side that the nail was placed on. Making the nail on that side slightly shorter, you also reduce the size of the nail being curly and as wide. So, up next, sadly, amputations are quite common in the podiatry world. Due to injury, bone infection, or simply not taking care of yourself, you can have an amputations. Amputations have been done in many ways throughout the years. So for below knee amputations, the calf muscle is then fit and fashioned to fold upward toward the knee to cover the edge of where the shin bone was cut. After it is folded, and the skin will be stitched up in comparison to sawing off the lower leg by going in a left and right motion, as where it is shown in the Civil War. Today, the saw that we typically use in surgeries is a very small handheld saw that is about 2 inches in width that vibrates in a fast cutting motion that we would use after we would use a different instrument to cut through the tendon and the bone, the tendon and the skin, to then reach the bone. A fun fact is approximately 60,000 amputations were performed during the Civil War between 1861 and 1865, more than any other war which the United States has been involved in. 3/4 of all operations were amputations at the time. There were 13,767 different types of below hip amputations throughout the Civil War, including the toe, the foot, the ankle, below the knee, or even above the knee. As you can see here, for the thigh, they had over 6,369 below hip amputations. During the 1800s, these amputations were done by cutting off the limb quickly in a circular cutting saw motion to keep the patient dying from shock and pain. Remarkably, the resulting blood loss rarely caused death. Surgeons often left amputations to heal by granulation, which is not a very good idea. The granulation is a natural process by which new capillaries and thick tissue form, much like a scab, to protect the wound. When they had more time, surgeons might use the fish mouth method. They would cut the skin flaps, which looked like a fish's mouth, to sew them into a rounded stump. I would make that face right now, but I don't want to embarrass myself, so it is just typically looked like as an upside down U. So whenever you have the shin bone and the skin is folded up with the calf muscle, right there where my fingernails are is where you would have the stitching of the upside down U, called the fish's mouth method. Leaving an open wound today would not be a very good idea. In the 1800s, they most likely figured this out the hard way. I will admit during now, some amputations typically leave a very, very small hole for the drainage of the wound when necessary, but in most situations it is split for drainage, but that is not a good idea. We would only typically use that small hole for drainage if it is in between two stitches. We would never completely leave a wound open after an amputation to let it heal by granulation. In an amputation, a person's arm or a leg, or sometimes just a hand or a foot, is removed from their body because of a terrible injury or infection. Military advances before and during the Civil War meant more powerful destructive weapons and more devastating injuries, including shattered bones. Most American doctors, however, were unprepared to treat such terrible wounds. Their experience mostly included pulling teeth and lancing boils. They did not recognize the need for cleanliness or sanitation. Little was known about bacteria and germs. For example, bandages were used over and over again on different people without being cleaned. If despite adequate treatment after that, further amputation is most likely needed because of the sanitation problems. After that amputation, and you constantly use the same bandage over and over again, with different patients, you are most likely going to get an infection and need further amputation. So, diabetic ulcers and gangrene sores. It's kind of gross, and it is the only part that I would say is actually the most noticeable. So, it was Markel D. Clave in 1852 and Thomas Hodgkin in 1854 who realized that there was an association between diabetes and gangrene of the foot. At that point in time, it was common to treat ulcers by prolonged bed rest, although it was noticed that the wounds would then return once the patient started to mobilize again. Now, why is that? The healing process for diabetics is beyond difficult. It is common for the diabetic patients to have an ulceration on their foot that would also have a correlation to neuropathy. The body will not tell the wound to heal, so it will not create a scab on most like healthy people. Bed rest is still used now, but to make it easier for the patients, they would refrain from walking by only using a wheelchair with one leg rest to prop up the foot and alleviate the pressure on that specific area. Along with strong padding that stays loose or tight, depending on the amount of drainage and the strength of the wound, the thick bandages were very important if you have an extreme amount of drainage from this open area or if you do not want to deal with the smell. Debridement of the wounds is the most important step to wound healing. Debridement is the stage where the area surrounding the open wound, typically a macerated white thick area, is slightly tampered with by using a scalpel. When you cut these sides of the wounds, you send a signal through your body to tell yourself that this is a brand new wound, and then the body starts to begin the healing process with scabbing and clustering of new skin cells to minimize the size of the wound. Similar to many other offices, it is shown that on challenging medicine, after debridement, an antiseptic cream would be applied to the thin, fresh pink epidermis layer. Once the patient started to mobilize again, he has instructed the patient to wear a thick pad of felt plaster over the healed ulcer to reduce pressure and prevent reoccurrence to the wound. At the end of the 19th century, therefore, a podiatrist named Travis had established 3 important principles in the treatment of ulceration of the foot: sharp debridement, offloading pressure, and education and care about the foot and shoe wear. Doctors continue to take notes of these steps and use them on a weekly to bi-weekly step to seeing these patients. Graft application has been used for more than 3,500 years. What is a graft? A graft is a good, healthy, collagen-filled skin from multiple different places, including donated placenta, foreskin from circumcisions, procedures, and animal skin, mainly including pigs as well as fish skin. These grafts are amazing for the healing process because after debridement, when the body thinks that you have a new wound, the cells will easily attach to the collagen-filled graft, making the healing process speed up by 1,000,000%. Grafts are also very common for burn victims as well. As you can see here, this was not a burn victim. This was someone that did use grafts as well as these pictures here. This one right here was a gangrene sore, and then that area of the foot got amputated. So then for further healing processes, we also used graft applications to help get this patient's foot healed, and the after that it looks like now is absolutely amazing, using skin from pigs and placenta. This one right here is my favorite. It is not needed to have a graft because this is the only open area. There was actually just a sewing needle lodged into somebody's big toe. They had no idea that there was a sewing needle in her big toe because she had neuropathy. The patient that had idiopathic neuropathy could not feel that there was a sewing needle in the bottom of her foot. So once this x-ray was taken, then we were able to remove the sewing needle, as you can see right here. Thank you so much for watching my presentation.